hormone replacement is great for somebody who doesn't have breast cancer, but somebody who has a hormone-sensitive breast cancer being treated, and you're treating them with hormone blockers, how do you talk to them? What do those patients go through? Is hormone replacement therapy even an option for them?
Yep. So really good questions. I'm going to tackle the last one first. Not all breast cancers are the same. If your breast cancer is not hormone sensitive, and by that we mean estrogen receptor negative, progesterone receptor negative, and we shorthand it as ERPR negative. Actually, more and more we are realizing those women can be a candidate for hormones if they need them. And that's really important because the classic person who has that is 42 years old. She had something called triple negative breast cancer, which is hormone negative breast cancer. She was a BRCA carrier, so we took her ovaries out, so she didn't survive breast cancer just to get ovarian cancer, but now she's menopausal at 42 and she's suffering. That woman is a great candidate for hormone replacement. And in fact, there is really good data if a woman loses her ovarian function before the age of 45 for any reason. It could be autoimmune disorders, it could be surgery, it could be cancer. If you do not add her estrogen back, you actually shorten her life. There is a survival cost to it, an overall survival cost due to cardiac problems and bone health. So the recommendation, I call it estrogen add back. This isn't hormone replacement. It's like if your thyroid fails, we give you thyroid hormone. If your ovaries fail before 45 years old, we need to give you ovary hormone unless we can't, which is the question you're asking. So young women premenopausal women who have an estrogen sensitive breast cancer, if we block the estrogen in their body, and there's a couple ways to do it, they have a survival advantage because that estrogen, unfortunately, is actually feeding the potential of a second tumor. So you can either give them a medication that allows their ovaries to continue to make ovarian hormone, estrogen and progesterone, but blocks it at their breast. Common one that people have heard of is tamoxifen. People hate that drug. That's the one where there's like whole chat rooms dedicated to how miserable that drug is. Actually, the data shows about 50% of women have side effects and about 50% of women don't. So for women who are nervous about it, I'm like, try it. We'll know in 6 weeks if you're miserable. We know which side of the line on, but if you're not, don't go in the chat room and be like, I don't know, I feel fine, they'll all come after you. But the good news is it's a good option for you.